Please stand by. Our news conference will begin shortly.
Good afternoon again, everyone. We will open our media availability today by turning it over to Dr. Janice Fitzgerald, our Chief Medical Officer, for today's update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media availability yesterday, we have no new positive cases. So the total number of cases in our province remains at 261, with 243 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. We have 22 people under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 50 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 3 people are in hospital due to the virus, and of these patients, 1 is in intensive care. 247 people have now recovered, and in total we have tested 10,152 people. Together we have done quite well containing COVID-19 in our province since households began doubling their bubbles 2 weeks ago. This is to each of our credit for our ongoing collaborative efforts and discipline in following the public health measures that are in place. As long as we continue to do so, we will slowly but surely move through the provincial COVID-19 alert system. It will take our continued patience, commitment, and cooperation, but the short-term sacrifices we are making right now will pay off in the long run, while helping us protect those around us who are most vulnerable to this virus in our families and in our communities. The personal public health measures we have come to rely on to keep us safe will continue to do so as long as we keep practicing them. Please stay at home as much as possible, especially when you feel unwell. Practice proper cough and sneeze etiquette. Wash your hands often and well. Maintain a safe physical distance of at least 2 arms lengths from others while in public spaces. And wear a non-medical mask or face covering when keeping this distance is not possible. These simple but effective actions remain our best defense against COVID-19. I would like to provide clarification today about public gatherings. Alert Level 4 allows gatherings of up to 10 people for funerals, burials, weddings, and essential workplace-related certification and training. Food and beverages are not to be provided at these gatherings. Tissues, waste baskets, and hand hygiene stations must be readily available. People attending these gatherings are reminded they must still keep a safe physical distance from others and can only attend if they do not have symptoms of COVID-19. Individuals over the age of 60 with chronic health conditions and at increased risk for severe illness due to COVID-19 should consider not attending gatherings at all. We are still advising people to stay within their bubble as much as possible, whether it be a single or double. So while we have increased the number for gatherings, this does not mean that extended family get-togethers, backyard or dinner parties, picnics, or recreational activities with others outside of your double bubble should occur. We are not at a place where we can do this just yet. This restriction is difficult for us all, but physical distancing is one of the most effective prevention measures in slowing the spread of this virus, and we must remain diligent in this regard for now. The more people you come into contact with, the more risk there is of contracting and spreading the virus. So we must all work to keep that number as low as possible outside of our bubble. As Victoria Day weekend approaches, the May 24th traditions many of us look forward to will not be the same this year. However, this does not mean we cannot still do some of the things we enjoy outside with members of our double bubble. And I would encourage everyone to try to make the best of this weekend, knowing that your sacrifices are directly helping to protect others and keep them safe. When I see each day the great lengths we are willing to go to support one another in our province, I'm filled with tremendous pride and appreciation in knowing that during the most challenging times, we rally to protect each other. We may not be there yet, but we started this together and we'll finish it together. Our actions to date speak for themselves. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, and good afternoon again, everyone. And another day of no new cases. This is a thumbs up day for Newfoundland and Labrador. This is the type of information that us at this table, of course, we're very happy to relay to you every day during these briefings. So to everyone, thank you for doing your part in stopping the spread of the virus throughout Newfoundland and Labrador. Let's keep up the great work by continuing to follow the public health guidelines that Dr. Fitzgerald and her team has put in place. They are there for a reason, and as Dr. Fitzgerald said, they're working thanks to the responsible actions of Newfoundlanders and Labradorians. It is only by working together that we can keep and stop the spread of this virus throughout our province. So while we continue to protect our health, we continue to work and collaborate with the federal government to put supports in place for families, for businesses and industry to help us all through this pandemic. So just about an hour ago, the federal government announced further information about the Regional Relief and Recovery Fund. It's nearly about $1 billion to support regional economies and small businesses and organizations and communities throughout Canada. And the idea here was to fill some of the gaps from some of the previous announcements that were put in place. Now, the funding will be provided through 6 regional economic development agencies, and the one that we would be familiar with in Atlantic Canada is ACOA. That's the Atlantic Canada Opportunity Agency. This is there to assist businesses in many rural and remote communities in our province. So if you didn't receive funding under another benefit as the Canada Emergency Response Benefit, and there's quite a few, this new fund may apply to you. So this will help your business continue their operations. And the whole idea here is that you can continue to pay employees. So this keeps employees on your payroll. So what it comes down to is further supporting our communities, our economy, and in turn our residents who need it the most. About a week ago, if you remember, we talked a bit about the Canada Emergency Student Benefit. That was announced, and today we're pleased to be able to update you and say that the applications for this particular benefit for students will be open on Friday of this week. That's May 15th. This is a benefit that will provide some $1,250 a month for 4 months for current students and recent graduates. You can apply by going to the Canada Revenue Agency. And to expedite your application, you should ensure you have a MyCRA account. Set it up with your current banking and address information. This is a way to expedite the processing. So aside from putting supports and resources in place to help you and your family, we are continually updating our public health measures to ensure we protect you, your health, and safety throughout our province, making sure that we stay on track. If you look at what's happening across the country, we're still seeing this virus spread in many provinces. So it's important we follow the guidelines. Let's stay on track. The spring weather has arrived, and that means some people are looking at making a new addition. And just recently this morning, we put in place, or Dr. Fitzgerald announced, some new guidelines for car dealerships. So please make sure that you use all the safety precautions if you plan to test drive a vehicle at this time of the year. Remember now that these actions aren't just for your protection, but they are also meant to protect the workers who will be working on those cars, but also those individuals that may want to take the same vehicle out for a test drive. So for further information pertaining to these updates and any other workplace information, visit our website at gov.nl.ca with a /COVID-19. Our website is updated regularly and sometimes even by the hour. So it is a great resource for information and questions on anything and everything related to COVID. And this includes all the supports that have been put in place for you and your family. We get a lot of questions recently and feedback from people who want to return home for numbers of reasons. It could even be like a death in the family. So if you believe that you qualify or you're looking for an exemption to enter Newfoundland and Labrador, you can now fill out this request form online. Go to the Travel Restrictions Exemption Request. The application is there on the COVID website. You'll find it under the heading of Public Health Orders. Also, about speaking of support, something that we haven't talked about in quite a while would be the Red Cross Helpline. That's still available. So if you have concerns or issues arising as a result of you or your loved ones from being in self-isolation, a range of supports is available by calling the Red Cross Helpline. This service is available to all residents and visitors in Newfoundland and Labrador who have been impacted by a direction to self-isolate to limit the transmission of COVID-19. There is a number there that you can call. It's 1-800-863-6582. We're now heading into week 11 in our province, and over this time, a lot of people have been working nonstop around the clock to keep us all safe. They have done a tremendous job. Now, while our government and health officials work diligently day in and day out to put guidelines and financial supports in place, I've noticed many positive posts and pictures that we've seen from residents. Certainly, it brightens an otherwise challenging time and often dark times for people in our province. I've seen so many familiar pictures of families and friends who doing video chats and sending well wishes to each other through a window pane. So you know that if there's any one thing that we do well as Newfoundlanders and Labradorians during challenging times is we find a way to use good old-fashioned Newfoundland and Labrador humor to lift the spirits of some of the most vulnerable in our society. So it's in times like this, as Dr. Fitzgerald had just said, that it makes us all extremely proud to be a Newfoundlander and a Labradorian. So let's continue to look out for one another and continue to work together. And until we have a vaccine, as been just mentioned, the best tool that we have, the best ammunition that we have, is to keep practicing safe physical distancing, proper hand washing. That must be our top priority. So it's important now that we continue to stand together in this unprecedented time and take every step that we can to support one another. We are essentially one big family. So thank you, Newfoundland and Labrador. I will now turn it over to another member of our family, and that is Minister Haggie, for his comments today.
Thank you, Premier. And again, no cases is an excellent testament to how hard and how diligently Newfoundlanders and Labradorians have worked to contain and adapt to this virus. I have a couple of comments to make before we turn it over to the media for their questions. I think first I'd like to take this opportunity to recognize Trades NL. They made a very generous donation today of $15,000, half of which they want to send to the community food sharing group and half to go to the gathering place here in St. John's for those folk who are less fortunate than most of us. Thank you very much, guys, gals. I really appreciate it. Yesterday, we had some discussion around easing of restrictions, and the municipalities, particularly the City of St. John's, had relaxed some of its requirements around municipal parks. I think there was some discussion yesterday. One of the challenges we have provincially and municipally, I would imagine, is there is no playbook for doing what we're doing now. As the Premier and Dr. Fitzgerald and myself have said before, it was really relatively straightforward under the new health legislation that we had to kind of lock things down and work to contain the spread. And that's worked. Now what we have to do is figure out how we move towards a state of life where we adapt and we live with the virus. So just like the provincial government has worked through some arrangements on the advice of Dr. Fitzgerald, the municipalities are also trying to do the same in their own way. And the comments around the use of public spaces and parks and the limitations they put on them are made with the best advice they can get, putting a common sense, practical Newfoundland and Labrador lens on the situation. And it's designed to help people do a little bit more, but do it safely. And as the Premier says, Newfoundlanders and Labradorians are renowned for their ingenuity and their ability to cope with unusual situations. But I would encourage everyone to continue to use that in the way we have, which is to adapt to a new reality, to the existence of COVID-19, rather than to use that ingenuity to try and find loopholes, simply because loopholes will always exist. And I would encourage you to stick with the former and not the latter. Some other comments, and indeed my entire time in the Department of Health has been around mental health. And we've emphasized some of the tools and some of the approaches we've had around mental health. But several commentators have raised the issue around addiction services, and in particular addictions and alcohol numbers. We don't have any hard numbers that we can easily generate at short notice around numbers of individuals who may be seeking help for specifically alcohol addiction. What we do have is an impression from our data that the demand on formal addiction services has not increased and may actually have gone down a little in terms of accessing some face-to-face services, pretty much in line with what you've seen across healthcare in general. We have canvassed our community support groups, and one of my great learnings was the importance of groups like this in doing things for marginalized groups that government is never in a position to do. What seems to be the case at the moment is in substance use generally, there appears to be an increase in usage. This is a combination of things driving it, a lack of routine, a lack of sleeping, a lack of access to some of the more customary support services that have been provided face-to-face, and a reluctance maybe to go down other routes. Support groups have risen to the task and are advising me that they are seeing people relapse. They are seeing challenges with accessing street drugs. These are unpredictable. They've gone up significantly in price, I'm told, and they are also being adulterated with baking powder and all sorts of substances, making them way less safer, particularly in the light of the fentanyl issues that we've had before. So we are working closely with our community groups to provide them with the support that they need to support the vulnerable populations that they serve. We continue to offer through the healthcare system things like doorways, channel, and these kind of things, which are as low barrier as we can make them, recognizing that we do have to live in a new environment around public health restrictions on face-to-face. The challenge for all of us is how to do what we need to do, but to do it in a way that recognizes that COVID-19 is here. It is here to stay for at least 18 months or 2 years. It currently has no vaccine. It currently has no cure, and there is no specific treatment that can be provided. It only moves. The virus only moves if we move, and hence the emphasis we've made initially on social distancing and latterly on the advice of public health officials about the use of non-surgical, non-medical masks. So these are key things that we need to adopt as a new way of life. The challenge now is opening the door and relaxing to alert level 4 with the prospect of going to alert level 3 and hopefully down that road over the coming months. The challenge now is to pace ourselves and to use the discipline that we've shown over the last 11 weeks, as the Premier referenced. Because if we rush it, we will wreck it, and we will end up back where we were 4 or 5 weeks ago. I cannot do this. Government cannot do this. The municipalities can't do it. We collectively have to do it. And the best way of doing it, as has been said before, is to make your bubble, expand it or not, protect your bubble, and respect everybody else's. We've done it to date. We continue to do it, and that is what will get us through this. So with that, Premier, I would close at this point and hand it back to you.
Thank you, Minister. If we rush it, we will wreck it. I think that's good advice for all of us as a sign of caution to Newfoundlanders and Labradorians. And With that advice, I now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
Please press *1 at this time.
Seems to be a little bit of trouble there. We'll move on to Peter Cowan of CBC News, and we'll come back to Kellyanne. Go ahead, Peter.
Fitzgerald, you touched on this at the beginning. As people plan for May 2-4, I think some are confused about what they could be or what they should be doing and what they shouldn't be doing. Can you give us some examples of the activities you'd like to see people doing this weekend and some of the activities that they should be avoiding?
So we would encourage activities that, are within your bubble, whether that's your own household bubble or expanded bubble. And some outdoor activities that you would do in that situation would be fine. So hiking or getting out for a bike ride or something along those lines. If within your bubble you want to do something at home, that will be fine as well. But, it's really about trying to keep yourself safe as you can within your bubble and trying to get out and enjoy the fresh air if we get any, and no snow. We know it's 2-4, so could be anything.
And what about the activities we should be avoiding?
So we certainly wouldn't want you to be doing any kinds of activities where you're coming into close contact with somebody in another bubble. Any larger gatherings we wouldn't be advising, and you want to try to avoid going into public places as much as possible. That's advice that we've been giving all along. So all of those all of that same advice still applies.
Premier, we've seen that Memorial University and Kona have decided this fall that almost all of their instruction is going to be online. Is that a sign of what's coming for elementary and secondary schools?
I think there's some lessons that we can learn and some information that we can take from that. As I said a few days ago, that we're actually planning now for what options and different scenarios for September. I think the minister will be in a position to make an announcement very soon on that. I mean, we need to be able to make a determination of the school closure for this year. I think no one's anticipating that it would be opening any time between now and then, before the end of June or the middle of June, a normal school year. So, we'll get some final decision on that now soon, but also what the plan would look like for September at a K-12 system. I think Memorial University and CNA announced their plan on May the 7th. Memorial had been in discussions and out there and publicly within the last day or so. So I think we can see where this is going, and with the unknown of what September would look like in the K-12 system is important we get those plans in place.
We'll now go back to Kellyanne Roberts of NTV News. Please go ahead. Operator, are you able to manually open her line?
Yes, one moment, please.
Thank you.
Please go ahead.
Thank you. I'm wondering, Dr. Haggie, if you can speak to this, or the Premier. The St. John's Status of Women's Council say they're disappointed domestic violence and how you get help isn't a part of the daily updates. Given the stats that illustrate an increase in violence against women during a pandemic, on top of what they're asking for is a central help phone line, what is your response to this?
Yeah, there's a number of things that we've been putting out there in terms of domestic violence and support lines that would be in place. But I know there's been some letters now that's been coming around from certain advocacy groups on this, and some very important things. And we're quite aware the opportunity, I guess, and some of the most vulnerable that we have in our society right now, indeed, would be women, given the fact that with self-isolation, less people moving around, and just being more enclosed, just the opportunity for violence, particularly against women, is certainly increased at this time of the year. So it is important for us to make sure that we protect those that are most vulnerable. Violence is never tolerated. There is a five-point plan that I know that's been having some discussion. Many of those points have been already in place within our province, and some very good information there that we need to work on. One is a dedicated helpline that we can actually probably coordinate with some other lines that are in place. But one of the things that they mention is having some women in leadership roles, and let's keep in mind that we are the only province in this country that has a standalone department responsible for the status of women. We've already done within recent months 3 leadership forums. So there's quite a bit of work that's been done, but we should never let up. We realize this pandemic is having disproportionate impact on women in our society, and we must be able to respond.
Thank you. And is the province going to provide guidelines for businesses that can reopen in level 3, such as hair salons, estheticians, businesses like that, or are we suggesting everybody call the business guidance team?
So there are guidelines that are either have been developed or in the process of being developed for businesses that can open in level 3. And certainly we will be working in coordination with the business response team to be able to provide that guidance to businesses.
Thank you. Is there an update on the contact tracing app as well?
The work, as I understand it, is progressing well. We have a deadline, hopefully, of the next 3 weeks, maybe 4, of getting the finished product into the Apple and Google stores. That is a little bit of a process that relies on something outside of our own control, namely those 2 main companies. But my understanding is we're not far off. That discussion has already started, so I'm told it's a 3 to 4 week process.
Thank you.
Our next questions are from Ben Murphy of BOCM News. Please go ahead.
Reasons our testing numbers are lower is because you actually need something to test, and you are meeting the criteria to be tested, even with that expanded criteria. So could we possibly use that extra testing capacity that we have to, maybe enable some things to open up to provide more necessary health services, like just, for example, physio or dentist?
So is your question, could we test people so that they could go to appointments in these places?
Yeah, essentially.
So what we have to remember with testing is that it is a one point in time result. So what your test is today may not be what your status is tomorrow or the next day. So there is this false sense of security that can come with testing people. There's also a risk that the answer that you get is not correct. And if you have a low prevalence of the disease in your population, which we do at the moment, then your risk of having a false result is higher. So we need to be cautious about the way that we use testing. It needs to be answering a question that it is designed to answer and that we can rely on for it to answer, or else the answer that we get is not useful.
Okay, and the issue of testing, just to add a little bit of context to that, the issue of who to test and under what circumstances with this current test is a source of ongoing discussion at the health ministers meeting, and we have the most generous criteria of any of the jurisdictions. The challenge is, and this is one that's being worked on at the national level, is there is no screening test for COVID-19. And so we do not want to use the diagnostic test in the wrong circumstances because of the issues that Dr. Fitzgerald has quite nicely explained. So the cleft stick is we have the capacity and we will need that capacity when the next wave comes, but we can't use it in advance of symptoms in a way that actually alters what we do for individuals and what care we provide.
So, Ben, in testing, I mean, there's a lot of conversations that occurs on a daily basis about the number of tests in a province. And one of the things I want to, update people in our province on is that not every single province records the testing the same way. As an example, there are only 2 provinces in this country that actually record and report on the number of people tested. It would be us and one other province. Most provinces are recording their numbers by the number of tests that they actually do, not the number of people that they do, because some individuals would have more than one test. So if you did our testing and did it just based on the number of tests performed, we would be recording now at 23% higher than we really are. So there is a difference in the way provinces are recording your information and reporting your information, and it's only one other province that report like we do. If we reported the number of tests done, we would be much higher, and we're doing a very good job doing contact tracing and getting to, as the Chief Medical Officer said and the Minister said, of getting to those individuals. We go there on a mission looking for a result.
Okay, thanks all of you for that. Dr. Fitzgerald as well, the Canadian RV Association is now joining the call to allow private campgrounds to open in Alert Level 4 rather than Alert Level 2. They released a full list of recommendations for owners, employers, employees, and campers to follow. Is this something you are considering now, or is this still just a hard no?
So as we've said before, if people or associations are able to present information that can mitigate some of the risks, that's something that we will consider. So, that's where we stand on that, and that's where we've always stood.
Okay. And also, a lot of outfitters are concerned as hunting and angling is now allowed, of course, with restrictions in place, yet the bulk of their customers are, of course, coming from the U.S. or the mainland, and they're not going to be able to enter the province for the foreseeable future. Is there any kind of plan being worked on for these kind of people, or will this fall into that tourism plan that Premier you said was being worked on?
So the question would be, in terms of travel to the province, that would be, work with the public health officials. But for relief and working with those businesses, that have been negatively impacted as a result of the decisions that have been made by the province and the federal government. And you're absolutely right, Ben. There's no question that outfitters, a big portion of their customers would come from, and their clients would come from outside of the province. And so right now we'll be working with those industries to see what business relief that we can put in place. There is no question that travel into Newfoundland and Labrador has been very restricted, and therefore the pool of customers and those that would have been, annual visitors in many cases to our province would not be able to come here this year. So we want to work with that industry to make sure we can support them in any way possible.
Okay, thank you very much.
Our next questions are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
Per capita number of people receiving OAS and GIS, and on the face of it, it would seem our province might benefit more. Premier, were there any conversations about provincial differences in these OAS and GIS before the top-up was announced by the Prime Minister?
Yeah, there's conversations that would have occurred in relief and support for seniors. And of course, this is a federal program that's federal dollars. There's no provincial dollars in this program. OAS, if you're a single person, you would get, the extra $300. If you're receiving GIS, it is complemented by another $200. That's $500 in total as a one-time payment. So this is a federal government initiative. We supported it. We think it's a good idea. And in terms of who would be impacted the most, of course, we have an older population and a very high percentage of seniors within Newfoundland and Labrador. So it goes without saying, on a population base, we would receive a good number of those that would qualify. So it's a good program. It supports our seniors, and we know that they've had to deal with some hardship in recent months, as well as the pandemic has impacted their lives.
And it was recently estimated that it could take Alberta 2 years to go through its surgery backlog. Does this province also have a projected time frame where it could catch up to all its backlog?
We haven't worked out how long it would take, simply because we're not at a steady state yet. we know we have somewhere of the order of 5,500 or so surgical procedures that were deferred because of the emergencies only routines that we put in place for COVID-19. What will happen now is obviously that group will not go down as fast because we're starting slowly. The RHAs have plans, and my understanding is each of the health authorities is making a local announcement about those plans sometime over the course of today and tomorrow. I can't give you an exact timeline. It really depends as well as whether or not when we get to the next decision gate in 25 days, whether or not we're actually able to move to alert level 3 as well. So I think it would be premature to give you a time frame.
Thank you. And when it comes to COVID cases, we're getting the breakdown of like age and gender, but I was wondering, when it comes to testing, what other types of information are you collecting? Like, are we also getting gender, age, and maybe socioeconomic status?
We
certainly have. Sorry, Janice, you go ahead.
So anyone who's getting tested, we are getting age, gender, we are getting symptoms, and there are other demographic information that we're getting as well. Of course, with regard to a more detailed breakdown, that's usually reserved for people who are cases or contacts of cases.
Thank you.
Hello? Did you have a comment that you wanted to make?
Oh, no, I just thought the line just went mysteriously silent. I thought I had a technical problem.
Minister Haggie, did you have a comment you wanted to make?
No, Janice covered it. Thank you.
Okay. Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi. I wanted to ask, can you give an idea of what specific kind of directions or rules you set out for RHAs ahead of their medical procedures, other than, they're triaging the most urgent cases? Is there any specific guidelines that you've given them?
We've had extensive back and forth with the regional health authorities, Peter, about what would make sense. Remember, we have to keep a buffer of beds. We have to make sure we don't burn through our PPE. We have to allow for the increased usage that increased activity, planned activity would take. So they have set bandwidth of, for example, increasing their surgical throughput by 25%, their diagnostic imaging between 35 and 40%, these kind of things. It will vary from area to area in terms of the geography of the building. But things like cardiac catheters, the dye test, things like ultrasounds, both specialty cardiac ones and general ultrasounds, and things like needle localized biopsies, those will all start. And each procedure or each test is stratified into a priority. Urgent, within 3 weeks, within 3 months, those kind of things. So that will and has been a source of constant review over the last little while by the clinicians involved. And you've seen people, in actual fact, who at the beginning of March were waiting, who were actually brought in sometime over the course of April or May and had their test and or procedure done. So it's very much a live, dynamic kind of process.
Okay. You've said over the past few weeks that you rely on Dr. Rahman's projections primarily to provide direction for future planning. And you talk about a second wave, and yet all we've had are ones and zeros. Is there any way to hang a hat at all on the fact that we have no cases whatsoever, or very few?
From the point of view of future planning, I think what we have seen are two things. One is the projections, three actually. We've seen the 30 to 60-day projections from Dr. Rahman's team. We've seen the Canadian Institute for Health Information's projections out to the end of the year, with a peak later on, sometime in the fall, depending on certain factors we discussed at that first presentation. It could come anytime between August and November. And then we also have the experiences of other jurisdictions over the last 3 or 4 weeks, where they have got to the stage of relaxing some of their constraints, their controls, particularly around border and travel. So you've seen spikes as a result of that. So Singapore, Korea, Japan, Germany have all seen resurgence of the virus when they ease travel restrictions either beyond a certain point or too rapidly. So I think, again, no playbook here, but the bottom line is we rely on our short-term measures around border control, modeling that we do, modeling for the Public Health Agency of Canada, and just looking out around over the horizon to see what's going on in other places. And the short message is that whatever we've done here at the moment, we are still at significant risk of it all coming back again.
And so, Peter, I think that, what we must always remind ourselves is that, the measures that we put in place by the advice that we've been given, that those measures are working, but it's not over. We're 11 weeks into this, and you just, need to just watch the news every night. You see some 72,000 Canadians that have tested positive. There's only 34,000 of those that are now considered to be recovered, and we've had over 5,000 deaths. And these numbers are doubling every 23 days. So this virus is still active, within our country. The measures are working, but it's not over. It's 11 weeks into this, and we must be determined and remain focused on, the plan that we put in place. And yeah, we want to move to alert level 3, but we got to do this with, the work that's been put in place and just making sure that we're mindful of everything that's happening around us.
Okay, thank you. Dr. Fitzgerald, Ontario has added this inflammatory condition. It was previously thought to be a rare condition. Now they're thinking it might be linked to COVID-19. Has that been done here, and have any clinicians encountered it with children?
We're constantly looking at the criteria that we need to include when it comes to testing, so the symptom criteria for testing. These inflammatory conditions that we're seeing reports of, they aren't common, but they're not new. They can happen after many different types of inflammatory diseases infectious diseases and viruses. So, we have, they aren't common, but we do see them from time to time in other things as well. So they're not really what we call pathognomonic of this virus in particular, but they can be associated with it. The other thing is that they're usually a post-viral phenomenon, so it's at the tail end of the viral infection. So using it as a testing prerequisite may not be as useful as some of the other symptoms would be. So these are all things we have to consider before we can expand our testing criteria.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hello. Question for the Premier. What exactly has Suncor told you about its plans for Terra Nova for the next 2 years?
Well, right now, from what I know, there's no definite decision being made on what would happen. We're still encouraging them, and we will continue to work with them. I know the minister had a conversation yesterday. We'll be speaking to officials now later before the week's over to, get a better understanding of what's happening between CNOPB and Suncor. Of course, our desire is to work with Suncor, work with the industry. The offshore Newfoundland and Labrador is an extremely important part of what's happening here. And Suncor is a company that's taken an active role in all the projects that we have offshore. It's actually Suncor that pays the most royalties when you consider all the projects that they're involved in within our province. So they're an important piece of our offshore. We want to work with them. We want to work with the industry leaders to make sure if there's anything that we can do as a province, and continually to press the federal government for something specifically related to the energy sector as well, and that includes our offshore. So all of these measures, once again, is we want to work with this group. So right now, from what I know, a final decision hasn't been made yet, but we want to make sure that we do everything we can as a province to keep Suncor active in Newfoundland and Labrador.
So just so we're clear, you don't have any details on how long the suspension, which has been in place since December, could last, and there hasn't been any discussion specific to things like layoffs?
Yeah, so the production levels that you're talking about since September, that was, obviously one of the reasons why they haven't been producing. And, this is an aging asset. When I talk about the asset, it's the FPSO that actually does the producing. So that would necessarily mean for them, for the life of that field, which would, potentially be up to another 10 years producing, somewhere around 10, 11 million barrels a day, is there would have to be an investment in that FPSO, in that asset. So, this means it would have to come offline anyway over the next year or so. So making sure, but for us, we just want to make sure we have a real good understanding, and we will do whatever we can to make sure that, Suncor stays in our province and be active. But first and foremost, we cannot forget that the safety of the workers are first and foremost, and it's that way for Suncor as well. But it's a tough time right now in this industry, and it's going to require all levels of government in this industry to work together. We have a good resource. We want to make sure we continue to promote it globally, and Suncor is a key player in doing that.
If this were to become a trend, if we were to see other oil offshore companies signal that they may be shutting down, in terms of the province's finances, is the federal bailout or a certain federal bailout, is that the only way out of this situation? And where are you at with talks with Ottawa in terms of I guess ensuring that the province would get some sort of federal financing?
There is not a week that goes by that this is not something that I bring and raise, at the federal tables directly with the Deputy Prime Minister, with the Prime Minister. I talked to the Minister of Natural Resources, our own MP, Minister Seamus O'Regan on this. Minister Cody and I are talking literally every day on this very issue. We'll meet with the industry now in the next, few days, both of us, to make sure that we're all working together. We had a discussion at our all-party committee yesterday. Keep in mind, 30% of the GDP in our province. You cannot replace that. The offshore industry is a huge generator of jobs, is a great revenue generator for Newfoundland and Labrador. And it's one of those industries that is a must-have for us to rebuild and keep our economy going in Newfoundland and Labrador. We can deal with the health crisis. We will get through that. But if you lose the offshore of Newfoundland and Labrador and the 30% of the GDP that goes with that, you just cannot replace that very quickly.
Thank you, Premier. We'll now take single questions from each reporter, starting with Kellyanne Roberts of NTV News. Please go ahead.
It's not on. Hello?
We got you.
Go ahead, Kelly.
Oh, sorry. Technology. I'm wondering if you can speak to, there's been studies that suggest 30% of post-secondary students may not return or attend class in the fall of 2020 because of the new format of learning.
Yes, you want me to comment on that? Yes,
please.
Yeah. I think it's one of the things that will come out of the pandemic. I think as we debrief and look at the lessons that we would have learned, is this whole idea that not only can you get an education from home remotely using technology, that many people can actually work from home very effectively. We have, over 4,000 people within our public sector that's working from home. We know Memorial right now for the first fall semester, they will be doing the same thing. CNA through the college system, they will be doing the same thing. And I think there's opportunities for us in the K-12 system to be able to provide that level of education. One of the things that we did know in all of this is that about 97% of our students already in the K-12 system are equipped now to receive learning from home. And with the great support that we get from teachers and schools and the English school district, the Francophone school district, I think we're ideally positioned to respond ideally for September of this year, regardless of what happens and what mechanism we will provide that education from.
Our next question is from Peter Cowan of CBC News. Please go ahead.
In place, or as you know, controversial. Experts are divided on this. CBC Radio has been trying for a week now to get the Justice Minister's perspective on this. On the Go has put in a request every day, but he's refusing to speak on it, saying that instead we need to talk to the Health Minister, who, while he has many talents as a surgeon and a pilot, is not a legal expert. Why is your minister staying silent on this?
Well, right now, all our ministers are those that I encourage those to, obviously, when they're asked if there's anything that they can provide, to the media based on questions that they would have been asked. They would be engaged, and ministers have been. But in this particular case here in Bill 38, as you know, that this was as a result of the public health measures, and Dr. Haggie, I think, has done a great job in answering the questions, to this particular piece of legislation. It's been through the House of Assembly. It has all-party support. So if there's one particular outlet, for whatever reason, someone would refuse or do not participate in that, that could be something, for another reason. But I know the minister has been available, and all ministers have been available. There's no one's preventing any minister from talking publicly, but the issue as a communications aspect of it can be dealt with in many different ways. And on Bill 38, I think the Minister of Health and Community Services has done a very good job in responding to the issues around that bill.
Thank you.
Our next question is from Ben Murphy of VOCM News. Please go ahead.
Sure, Haggie, how many of the 207 healthcare workers who are in self-isolation are being put up in hotels, and how much does that cost in the province?
That's a good question. We're now actually down to 198. I can get that figure for you. I don't have it to hand.
Okay, no sweat. Thanks.
Next, we'll hear from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Pandemic. Hello?
Yes.
Go ahead.
Hello?
Go ahead.
Go ahead. Oh, perfect. Prior to the pandemic, if someone had a urgent medical procedure that couldn't be performed in the province right away, they'd be sent out of the province for it to another provincial health authority. Is that something that still can be done under the current measures we're in?
Yes.
Oh, thank you.
And our next question is from Peter Jackson of the Telegram. Please go ahead.
Hi. I wanted to ask about the May 24th, what people can and can't do. You've already sort of covered that. Just so that people can get an idea, I'm wondering briefly what all you have planned for May 24th.
You asking me, Peter, as Premier?
Any one of you.
Well, I can tell you right now is my plans to go back to Deer Lake. I have not been in my district, have not been in my community since early March. And so my plan is to drive to Deer Lake for the weekend, for the May 24 weekend, and hopefully the weather will allow me to get outside for a few hours and get some exercise. Other than that, it'll be my first time out of St. John's really since early March.
Any other takers?
Yeah, I'll take a swipe at that one, Peter. I've got my deck all tidied up at home. I'm going to get the swing out and the barbecue and the fire pit, and hopefully just have a nice quiet weekend at home. Might take the bubble out on the side-by-side for a little run in the woods, but that's about the extent of it.
And I think I'm going to wait and see what the weather is, and then I'm going to decide if I go outside or stay inside. But I don't have any grand plans.
Thank you.
And our next question is from Patrick Butler of Radio Canada. Please go ahead.
Hi again. Just wondering about the time frame for controls or for the border restrictions. New Brunswick says they're going to keep theirs in place till the end of the summer. Quebec is saying that they will probably be lifted in the coming days. What are the plans for this province? Are we going to keep them closed all summer?
So right now for travel plans, and I guess we were taking advice. I mean, I think it's important for us. I think we've put the message out there loud and clear to people in our province and other jurisdictions. I mean, there's been some very difficult decisions that had to be made. Let's, it's a good conversation to have. You can imagine how difficult it is for someone from Newfoundland and Labrador, because we just like to see people show up. We make them feel special, as we've done for many, many years, is what we're known for. So it's been very difficult, I think, for the public health officials to be able to suggest that, traveling into the province would be restricted. But we know that's an investment into the future of our province. And, once the restrictions are released or relaxed and we can travel to here and enjoy Newfoundland and Labrador, that's what we want to get back to. But there is an investment in time that we have to make to get there and to get there safely. So we'll keep the enforcement measures in place as long as, we see fit, because, those decisions are made by the officials based on a number of indicators, not just what's happening inside our province, but where people will be traveling from. And also from the international side, it would require quite a bit of work with the federal government. I know there's an agreement that's been in place now that's set to expire soon. So, there are many different, there are many different things that you had to consider before you open up your border. Right now, we're in a pretty good spot, but we know when, it's by travelers coming into our province that, things could be very different today in Newfoundland and Labrador, and we do not want to expose our residents, to the spread of virus back into our community.
We'll take 2 more questions before we end today's call, so please press star 1 and the operator will identify you.
So we have a question from Patrick Butler from Radio Canada. Please go ahead.
Go ahead, Patrick.
I'm okay, thank you.
Thank you, Patrick.
Thank you. So we do have a question from Kenyon Roberts. Please go ahead.
Thank you. There's been many concerns raised about the breakout of a child's disease that we've been identified in New York. I can't remember the exact name of it off the top of my head. Is this something that we're concerned about here? Pediatric multisystem inflammatory syndrome?
Yes, so that's the disease I was talking about earlier. So we, obviously seeing this is something that we will be keeping in mind, and we haven't seen any cases here in the province, and I'm not sure that we've seen any cases in Canada that I've heard of. So, it's something that we're certainly going to be on the lookout for, and we would be reporting on those types of things, but it's fairly new and not. It's more of the body's reaction to the virus as opposed to an actual. It's a complication of the virus, I suppose, as opposed to a symptom of the virus.
Thank you.
And our final question today is from?
We have no further questions, registered at this time.
Thank you very much for attending. The time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.